listen to me. Good afternoon, everyone. We're so glad that you're here with us for our third virtual learning session in this series around how to turn data into direction, how to prioritize community needs in your community health needs assessment process. We had a couple of great webinars last year, and so we are very grateful for y'all to continue to join us in 2026, start the new year off right, and thinking about how this China Chip Learning Collaborative can make sure that we get the information to you that you need around developing the best Chinas and chips possible. So put in the chat your name, where you're zooming in from, and we will get started with the presentation. If Pam would like to go ahead.
All right, welcome everyone. We're really excited y'all are here. I see familiar faces, so thank y'all for joining us today. I'm Pam Gillum. I'm the director of the Center for Applied Research and Evaluation at the University of South Carolina in the Arnold School of Public Health. And my partner in crime is Melissa Thayer. She is with the Institute for the Advancement of Community Health, and we have been collaborating together for, gosh, a couple years now. Well, even longer than that, but been working specifically on looking at what does it look like to do a high quality, effective, community engaged, community health needs assessment and community health improvement planning process. And so we're excited that y'all are here with us today. I'm going to hand it over to Landon so he can talk about collective impact and action, which this is a part of the larger effort.
So thank you, Pam. Good afternoon, everyone. So before I hand it back to our experts, I'm going to briefly touch on our broader work at the Alliance through the Duke Endowment. So we have 4 key strategies to produce coordinated, data-driven action that reduces disparities and advances equitable population health across South Carolina. We do this in 4 ways. First, we strengthen the data infrastructure, and this provides the information needed to make informed evidence-based decisions across our partnerships. We're also aligning the China and CHIP processes. So we're establishing shared priorities and coordinated goals across our communities. We're also training in results-based accountability and its framework. So this is to create a common language, a common agenda, and translate plans into actionable strategies and measurable outcomes. And to round us out, finally, we implement clear impact scorecard. So this helps us to monitor progress, increases the transparency of what we're doing, and drives continuous improvements across the board. So with that, I'll hand it back to Pam. Thank you.
Thanks, Landon. So today I'm really excited that we're going to focus really on prioritization and what that process looks like. So Melissa and I, in phase 1 of this work, where we conducted a landscape assessment looking at community health needs assessment and improvement planning processes across our state, we learned a lot, and we learned how different ways of doing different things. But one of the challenges that we identified is, what does a prioritization process look like? How do you do it? Who do you include? Et cetera. And so today is really going to be focused on introducing you, if you're new, to what some solid prioritization processes look like. And then we're going to spend really most of our time in a real simulated hands-on experience for you to really orient you to one of 4 methods that we hope that you'll feel more comfortable with trying out when you go back home and you're conducting your needs assessments and improvement planning processes. So let's get started and talk about the key concepts and 4 methods before we jump into our learning experience together.
Well,
so Melissa,
yes,
you want to join it? Yeah, let's find out where people are.
So as Pam mentioned, I'm Melissa Thayer with the Institute for Advancement of Community Health. Excited to be on this project. And one of the things that we want to know is, what is your experience with the prioritization process? We're going to have seasoned folks in here who have been doing these CHNAs since the process started with the Affordable Care Act. And we're going to have other people that this is new to them. And it looks like we have 2 leading responses so far. About half of people know, about 45% of people have never participated or led one before. So we got a lot of newbies today, which is great. We've have another about 50% of people who have participated in the process. And we've got a few people in here who've led the actual prioritization process in their CHNA or some other project with their organization. So give it just another second or two for results to come in. And then I believe Katie's going to share the final result. Are these the final results, Katie?
Yes, ma'am. Those are the final ones.
Okay, so it looks like we've stayed about the same with about half of people have participated. Just under half have never done it before. And then a handful, it looks like 2 individuals have actually led one. So hopefully today will be a good learning experience.
All right. Great. This is awesome. I'm excited. I hope that you leave here today with all kinds of good ideas and are excited to go back and try a prioritization process. So let's talk about some concepts that are really important to know as part of a prioritization process. And forgive me for a second. I'm having challenges with my being able to move there we go. All right. So let's start with some operational definitions, okay? There's 3 concepts that are really important to know and think about when we talk about prioritization. So the first one is criteria. So in any prioritization process, we use criteria. And when we talk about that term, what we mean is it's a standard that we're using for making a judgment, okay? They're what we use to provide guidelines for making decisions. And so those decisions that we're making, the criteria we are using, we have to really think about what that criteria is based on whatever we're using the standards to judge upon. And that may differ based on your community, what's important to your community, what's important to your organization, lots of things to think about. They are not, as I mentioned, set in stone. There's not like this standard set of criteria you use in prioritization. It's really important that a conversation occurs about what criteria to use because every community, every organization looks differently. So the second term is priority. And so this really is just order of importance, right? Based on how issues may fall in relation to one another. Like a set of criteria, priorities also may change with changes in your community or with changes in what people care about or have knowledge about. So priority is a term that we use when we talk about when we're ordering things based on importance. And then the last term we have here is prioritization. And this is related to a decision-making process that allows a planning group to choose criteria and approaches rationally and wisely. And so this is really important because prioritization is not something you do haphazardly. It's something that we really take a very thoughtful, strategic approach. Okay, so why prioritize? Like, what are the benefits of prioritization? Well, first, it creates a structure that makes setting priorities more systematic and more likely to reflect the realities of the community. Secondly, it really increases the probability that you're going to get the priorities right if you use a very systematic approach to choosing what priorities are important in your community. It provides an opportunity to engage the community and build buy-in and ownership. So we spent in our second webinar talking all about community engagement and what that looks like. And we feel very strongly, Melissa and I do, and many of you also, that engaging the community in these types of processes is really important if you really want to get the buy-in and support, number one, and also get the work done and make the impact that you hope to achieve. So you can have processes that are really inclusive of your partners and interest holders in your community around setting the criteria so you make sure you don't miss anything. And also what it can do when you engage the community in prioritization, you're much more likely where the efforts far more likely to succeed if they've been involved from the very beginning. So establishing criteria in a structured and inclusive way really ensures that the process is a transparent and open one, and that any concerns are raised. It gives that opportunity to raise concerns and address them. It's really important as it relates to including those who are most affected by the problem. So we talk about individuals with lived experience a lot. So thinking about how do you engage them around decisions, around prioritizing issues that may be affecting them directly. Another great thing about prioritization is that it really helps focus on the best things to do, not everything you could do. Like it's one of those things where we can oftentimes get caught up and excited. We can do this and we can do this and we can do this, or, this is important, this is important, this is important. Well, we have limited time and resources. And so really thinking more strategically and systematically really helps you really hone in on where can we make a difference in terms of addressing issues in our community. To me, one of the most important pieces of prioritization is this reducing chances of selecting a pet project or strategic voting. I don't know if you guys are familiar with the term strategic voting, but go Google it. I was like, let's look at all these different ways. And if you go and you check out, there's all different kinds of ways where strategic voting is this idea. If you do like just straight voting instead of a more real systematic methodical approach like we're going to present to you today, what happens is that you end up picking priorities that aren't really important to all. It's really not consensus. Straight voting isn't. And so we're going to introduce you some real good methods today, one including multi-voting, which is great in terms of helping mitigate the issue around picking a pet project or straight voting. So these are just a number of things to consider when you are thinking about prioritization and why it's important to do a real systematic approach. Okay, 3 key steps to prioritization that I just want to put out there. Easy to remember, right? One is create a planning group. Get together a group that's made up of a diverse group of stakeholders and bring them together to plan the prioritization process. And think about including those who are affected by the community issues. One thing I really want to highlight and say that's important here is prioritization, especially if you're going to have a lot of people in the room and a lot of diverse perspectives, is that you have someone who is a very skilled facilitator. And so when we think about someone who's a really good facilitator, it may be one who is really good at engaging a group, who is very good at pulling everybody's perspectives into the table, out. And so it's not just one person or one group that's being heard from. Someone who's really good at keeping on task and on time, and just has those skills that are needed to help bring consensus within a group. Sometimes when we're responsible for CHNA or CHIP, we feel like we're also responsible for facilitating these processes. And one of the challenges behind that is you actually really need to be a participant, because you too are part of the community, or part of an organization, and probably have some opinions as well. And it can also remove you from being seen as biased or, not super, like that you may be somehow, because of your presence as the facilitator in the group, that you might be pushing the group to go in a certain direction. So there's some real advantages of having a neutral, solid facilitator to lead the group. So that's something a planning group would have to decide is, are we going to do it ourselves? Or are we going to hire a facilitator? Also, a planning group can help play a really important part in establishing the criteria that you'll use to help set the priorities. And so there's so many different criteria out there, y'all. Wait till I show you the list that we're showing you today. It's long. And so that's really important, that where the planning group can really help you decide what are the ones that you should really focus on as you are moving into prioritizing health issues. And not just health issues. I mean, in the community health improvement planning process, you can use priorities to help you prioritize interventions or programs too. So take that into consideration. And so once you've created your planning group, you've identified what that process is going to look like. Is it going to be a day-long retreat, etc.? You've established the criteria. You've made some decisions around elimination of health issues or programs based on the criteria. Then it's time to bring the group together and prioritize. And when you get together and prioritize, everyone needs to be on the same page around the criteria. So it could be, if you're working in a coalition, you could review the criteria at a previous meeting before the day of the prioritization process. You can decide on, the planning group will decide what prioritization method you want to use, but then you have to actually implement it and implement it well. And then keeping everyone on task and focused and reminding them of the use of the criteria is really important as part of that prioritization process. So prioritization is not something you can just say, okay, let's get together and we'll prioritize tomorrow. There really needs to be some good prep time and planning that goes into it. Need a solid agenda, very clear decision-making processes. All of that's really important as part of the prioritization process. So 3 key steps: create a planning group. With the planning group, establish and make sure that planning group is a diverse group. If you can include individuals with lived experience, it's fantastic. Second step, establish criteria. What are the standards you're going to use as part of the prioritization process? And then step 3 is to prioritize. So let's look at the laundry list of criteria that you could choose from. So just to say that this is a list that I've compiled. The National Association for City and County Health Officials has a great list. I've also gotten other criteria from other lists that I've come across. And these that you see here are commonly used as part of a community health needs assessment when we're really trying to create some criteria around prioritizing health issues or health problems, okay? And so you see everything from the size of the problem, like the number of people who are affected, the impact of the problem, like how serious is this problem in our community, the return on investment by addressing the problem, or how much is it costing us, the availability, adequacy of solutions, availability, adequacy of resources. Do we have the staff? Do we have the time? Do we have the expertise to solve the problem? The urgency of the problem, think about COVID-19 and what that looked for us. That prioritized for many of us what our work was on a daily basis. The feasibility of actually affecting the problem. What's our community's perception of the problem? Is it important to them? Are we ready as a community to recognize it as an issue and to address it? What's the long-term benefit? And then the fit. So from an agency's perspective, how does this issue fit in terms of our vision and our mission and our strategies as an organization, right? So this is just a list, that you could pick and choose from. Now let's look at another list, and you see that I put, I kind of have them broken up into CHNAs, some that might be more appropriate for CHNA and some for community health improvement planning process, but know that you're going to see them potentially listed on both. For example, the return on investment one is listed on both, okay? But this list here is common in terms of related to, like, when you're thinking about what are the programs or the interventions that we're going to put in place to address the problem. And so we may want to look at ROI again, like what's the return on investment for us if we put dollars and resources and staff time into a particular intervention or program. What's the likeliness it'll solve the problem? Do we have the staff expertise and time? You saw that on the previous slide as well. Let's get down to what about, like, does it fit what our community cares about or expects? Is it compatible with efforts that are already going on? So this idea of like, what are we already doing around these issues, and how does that fit with what we're already doing? The possibility, what are the opportunities for us to collaborate across organizations or share the workload to address a particular issue? Any legal considerations are also important to consider. And then thinking about what are those potentially unintended negative consequences of an intervention that could occur. So again, 2 very long lists of criteria. You will get these slides afterwards, so you will be able to see them again. But both of them are very comprehensive in terms of thinking about where you could start as it relates to coming up with criteria. And there may be ones that you come up with that are not listed here, and that's okay too. Okay, for the last maybe 20 minutes, we're going to talk about 4 prioritization methods that you could use. I didn't make these up. These all come out of, they've been around for a long time. They're not just used, of course, with, you know, governmental health agencies using them, or even in my world of continuous quality improvement in manufacturing, et cetera. They've been used for a very long time. And there's a guide that's listed in the resources that you'll have access to that NACCHO, the National Association of City and County Health Officials, they have what's called the Guide to Prioritization Techniques. And so I really used that as my primary source for talking to you about these 4 different methods. And so these are methods that have been really pushed by that organization and shared by that organization for governmental health agencies across our country to use to help them with prioritization, but definitely didn't come out of the public health setting. So let's talk about multi-voting technique. We are going to do this one today as part of our simulated experience. The reason why I chose this particular method for today is because it's a really good one to use when you're working with a community. I really like it because if you are, well, there's a lot of reasons why I like this one. Number one, it's not complicated, right? We're actually not using weighted criteria. So there's not really numbers associated with this. You do have criteria, but we're not asking people to assign any particular weights. This is straight up vote. It's not straight voting, but it's voting. It could be a sticky note. It could be like we're doing it virtually. So we'll be doing a Mentimeter poll. But what I like about it is it's, to me, true consensus. Issues that rise to the top are ones that all people pretty much favor. So this idea that an issue that may not be a top priority of any individual, but is favored by all, will rise to the top in this particular method. It really is about reaching consensus. It's also, as you can see, a strength is when you have a really long list of issues, it really makes it easy to narrow it down to top few. So there's lots of variations with multi-voting, okay? So it's not like, you guys have heard me say on previous calls, like there's lots of different recipes for banana pudding, right? And so there's even, with multi-voting technique, this particular method, there are a variety of ways you can do it. So I'm just going to mention a few of them. So for example, one of them is you could do more than 3 rounds. If you had a room, that's kind of the rule of thumb for like avoiding and mitigating straight voting, is having 3 or more rounds. But if you had a really large group, of 100 to 150 people, you may want to do 4 or 5 rounds of this particular, using this particular method. It really is a good one to use if you have a really large size group. Another variation is in the first round of voting. So one thing that you can do is you can let folks vote for as many issues as you want. So like if there's 20 health issues in that first round of voting, you can say y'all can pick all of them if you want to. Or you can limit them to a certain number, which is what we're going to be doing today as part of the learning experience. Another thing about the variation that you could do is after you've done the first round of voting, you can eliminate the number of issues based on half of like whatever the number of people in the room. So I didn't do a good job of explaining that. So let me try again. You can eliminate half of the issues based on half the number of participants. So if you've got 20 people in the room, you might eliminate the 10 that got the lowest votes, right? And so again, multi-voting is important. It's multiple rounds of voting. That's why it's called what it is, because it really gets you to reach consensus versus just having a pet project or pet issue kind of rise to the top. So that's one of the advantages of using multi-voting. And again, as I mentioned before, because it's not complicated, this is a great one to use when you're working with a large group and working within a community. Okay, so this is one prioritization method. Let's look at strategy grids. So this method is really useful because particularly in the CHIP process, because a lot of times this is primarily used for like when you're talking about programs or interventions you want to implement to address an issue. You can absolutely tweak it for a community health and needs assessment prioritization process. Totally can be done. But it's really good and often used typically by organizations when you're thinking about the programs, interventions you're going to be offering. So it's really great because it helps refocus efforts by shifting emphasis towards addressing issues that yield the greatest results. That idea of giving you the biggest bang for the buck concept, right? It's really good to use when you have limited capacity and resources, right? Like when we know we only have so much staff with so much time and a small budget, how do we want to prioritize our time? So as you can see, the way it's structured here is it's a grid, right? And the criteria for this particular example is need and feasibility. It doesn't have to be these criteria. You could pick different criteria, but again, they're using some sort of criteria. There's other examples of like importance and urgency might be the criteria you choose, or cost and impact. But here, this is an example showing you high need, low need, high feasibility, low feasibility, how you would set it up. And basically what you would do is, say you have a list of interventions and programs that you've brainstormed, you would put them in one of the 4 quadrants. And then that helps you prioritize like where you want to really focus your time. So this is a great example, again, if you want to do it within an organization that's responsible for addressing health issues and maybe trying to decide which programs or interventions they want to provide. So for example, in this example, for high need and high feasibility, they put a high blood pressure screening program in a community with rapidly increasing rates of stroke. So it just shows you how they placed programs or interventions in each of the quadrants. So strategy grid is a second example of a prioritization method you could use. Okay, the next 2 I'm going to show to you are focused on using numbers, like objective data and actually calculating scores. So let's talk first about the Hanlon method. This is a very well-respected method, and it really objectively takes into consideration based on very defined criteria and feasibility factors, okay? So there are some components here that I want to point out to you as part of the Hanlon method. Well, first of all, in this method, it's already been defined for you the criteria, the size of the health problem, the seriousness of the health problem, and the effectiveness of the interventions. So let's talk about each of these real quick. So size of health problem. So some considering like guiding questions you could ask yourself about this is, well, let me back up. This one should be based on data, baseline data collected at the community level. So that's really important to consider. What's the data you're going to use to collect to help you understand the size of the health problem? For the seriousness of the health problem, here are the questions you might take into consideration. Does it require immediate attention? Is there public demand? What's the economic impact? And what's the impact on quality of life? The third criteria is effectiveness of intervention. And this has, as you can see in the example here, it has a kind of a max and a min, right, for the effectiveness that measures the effectiveness. Now, if you were looking at interventions for certain healthcare issues, you could use the CDC's Guide to Community Preventive Services to give you a sense of effectiveness. But there may be other sources that you could use to understand the effectiveness of different interventions, right? So that's a big component of the Hanlon method is they've already defined the criteria for you, okay? Secondly is this PEARL test, okay? What I like about the PEARL test is it happens at step 2, which I think is kind of wild, is that they're having you do this assessment in terms of a rating based on those 3 criteria, but then they want you to also take into consideration these 5 components. It's an acronym: propriety, economic, acceptability, resources, and legality. And so is a program for the health problem suitable? Does it make economic sense to address? Are there consequences if we don't address the issue? Acceptability, will community accept or want the program? Resources, is funding available, potentially available? And legality, do current laws allow program activities? So what are the other cool thing I like about the PEARL test in particular is that if you answer no to any of those questions, you're tossing that health problem based on the PEARL test. So that's one way of eliminating a particular issue is based on the PEARL test. So you see the steps here. The third step, the third big piece of this is like calculating the priority scores, and it's basically the formula you see below. And I've just realized it probably doesn't make sense to you because I have it listed as A plus 2B, or 2 times B times C. So it's the size of the problem plus the seriousness. So A is size of health problem, B is the seriousness of the health issue, and C is the effectiveness of the interventions. And so you just plop in the numbers to create the score. Something to note, this rating scale is made up for this example. You could create a different rating scale, okay, based on what's appropriate for the community you're serving. You do not have to use this one. Just want to point that out. All right, so the Hanlon method, again, it's been used quite a bit. It's very well respected and used for prioritizing health problems. All right, one more to share with you in my last 5 minutes before we jump into our fun simulated experience is the prioritization matrix. Now, this one is very common, is common. It's really ideal to use if you have a large number of criteria. So if you're if you've got, and this, I couldn't put a table on here with all of the different criteria you could use, but this is just to give you a template of what you would use to do it. And I'm going to show you an actual example where I've used the prioritization matrix with a group. But what I like about it is it's for a large number of criteria, and it's also if maybe an organization has like only one health issue or just a very limited number of health issues they're going to work on. This is a great method to help prioritize the issues. So there are primarily 4 steps. One is you have the matrix. On the vertical axis, you list the health issues. On the horizontal axis, you're listing the criteria. Now, it's really important, again, with your criteria, you're deciding what it is that you're going to use. Here, I gave you 2 examples. Criteria not met, with a score of 1, criterion met 2, criterion met well 3, or priority could be it. And that's 1, 2, 3, or 4 is the rating there. And then you have to weight the level of importance and then calculate the scores. So let me show you an example that I did with a health agency. We had lots of criteria. You can see them across the top part of this example. So we looked at populations affected, we looked at disparities, we looked at how effective we're doing, and I showed the agency that we worked with, and I didn't mean to. Impact, severity, capacity for addressing it, access to expertise, effectiveness, and potential 3 or impact. And you can see we weighted here, right? So our weights here were like 0.25, 0.5, 0.75, and 1 is what we used here. Again, you can choose your weighting. And then we had the next level related to the actual health issue. And so basically, so you see, oh, I put the criterion up here, and then you are you're multiplying the 2 numbers together. So you see the example here in red, where the weight was 0.5, the public health issue was ranked as a 10, like just whichever order, and then we multiplied the 10 times the 0.5 to get 5, just to give you an example. So they had 25 issues they had to prioritize in that particular, and this was years ago that I did this with them. And so, and this list isn't even all of the health issues that we were talking about, but it just gives you a sense of what this prioritization method might look like if you were going to employ it. So you would need to rank the health issues in order, and then you also have to have a weight for the criteria. For each criteria, and you multiply them to get how you would prioritize them. Okay. So we're going to move into our prioritization exercise. And so there's some things I want to note about this before we get started. The whole purpose of this experience for you is to expose you to the multi-voting prioritization method, okay? You received via email when you registered, or earlier this week, all registrants received a profile for Big Old County that we're going to use as our made-up community that we all live in. And it includes made-up information. It has a list of the 20 health needs. It has some data on them, and it has the prioritization criteria. So because this is all made up and we're asking you to talk about a community you've never lived in, feel free to use your creative juices as part of participating and engaging in this experience based on what you know from the community in which you live in now, okay? This is just for fun. And again, it's really focused on the method itself in terms of exposing how you could do it. And this is the way we would do it, like you could potentially do it virtually. But of course, for many of you, you might do something like this face to face. All right, are we ready? We are all now actors. We all live in Big Old County. All right. So we're all members here in Big Old County, and we're community members of the Big Old County Coalition, BCC. Today, you are attending an all-day retreat to learn about what those key health issues were that were identified in the Community Health Needs Assessment that was sponsored by our healthcare system, BDH, Best Darn Hospital, and was led by our coalition leadership. So we had our coalition leaders that were part of the CHNA process. In the morning of our retreat, we spent time together where we presented the data on the major health needs from the community. You were also sent the report prior to today's meeting with some data for these health issues. And if you don't have it, I think Katie put it in the chat box for you, so you can download it from there. As a reminder, these issues were identified through our needs assessment process, which included the collection of qualitative and quantitative data, that included secondary data analysis based on what we as members of our coalition were really interested in learning about, and also from feedback from our community members that we gathered through town hall listening sessions, interviews, and a survey. So let's look at our 20 health issues. Here is our list: smoking and tobacco use, obesity, youth behaviors, air pollution, access to exercise opportunities, food deserts, access to parks and recreation, infant mortality, heart disease and stroke, cancer, diabetes, traffic accidents, asthma, sexually transmitted diseases, mental health, suicide among youth, drug use, uninsured, access to housing, and transportation. So now, after we've presented all this data to you this afternoon, we're going to spend our time together prioritizing. And we've got to narrow down this list to the top 5 health issues that we're going to work on and focus our efforts on over the next 5 years. That's going to be tough because these are all very important issues, right? But we know we only have so much time and resources if we want to see change in 5 years. So we had a subcommittee of our coalition members that came up with this criteria that you see on the right. We approved this criteria at our last meeting when we were all together, our last coalition meeting. So let's run through this criteria because this is the criteria we're going to use today as we prioritize. Burden. How much does this issue affect health in the community? Equity. Will addressing this issue substantially benefit those most in need? Impact. Can working on this issue achieve both short-term and long-term changes? Is there an opportunity to enhance access and accessibility? Systems change. Is there an opportunity to focus on, implement strategies that address policy, systems, and environmental change? Feasibility. Can we take steps to address this issue given the current infrastructure, capacity, and political will? Collaboration, critical mass. Are there existing groups in our community across different sectors that are already working together or willing to work on these issues together? And then significance. Was this issue identified as a top need by a significant number of community members? So we're not assigning any weights or scores to these criteria. We are just going to go through multiple rounds of voting so that you get to determine how these are, how they rank in terms of importance to you personally, based on your expertise and your experience. So here's how the process is going to look for us to narrow down this list of 20 to the top 5 health issues we're going to focus on over the next 5 years. We're going to go through 3 rounds of voting together. In round 1, we're going to do the voting right here together in just a minute, where we're going to vote on the top 20 health issues and narrow it down to 15 health issues. Remember, keep the criteria in front of you so you have it when you go to vote, because that's going to be really important. Then, after we see what the 15 are, we're all going to go into small groups, okay, for rounds 2 of voting and then for round 3 of voting. There's going to be 4 facilitators. So Hannah Hogue, Melissa Fair, Carla Tulin, and myself will be facilitating discussion in those small groups. We're going to be talking about the small groups, these issues, and we're going to ask for you to think about it based on the criteria that we have displayed up here right now. So in round 2 of voting, you're all going to be voting around the same time. Okay, so Katie is our timekeeper and our taskmaster. We love having Katie. She's going to be sending us a message saying, okay, you've had 10 minutes to talk about these issues, time to vote. And so we'll have time to vote for round 2. You will see in your small groups how we all voted across the groups. And in round 2, we're going to be going from 15 issues or around 15 to 10 issues. And I'll explain my comment I just made. Then we're going to do a second round of discussion after round 2 of voting. And then you're going to vote again. And we will see those results in the large, we'll come back together as a large group. Now, I am sure this is clear as mud to you. So don't worry, Hannah, Melissa, Carla, and I are going to explain this again in the small groups if it wasn't clear to you based on what I just said. Something I didn't point out, we're about to move into this first round of funding or of voting. One of the things that we decided at our last coalition meeting was that if we had a tie for 5th place, like to help narrow down the, like remove 5, we're going to remove any extra ones. So for example, say there were 3 issues that were voted on and they all tied for 5th place. We're going to add that, we're going to remove all of them as well. So we may potentially have less than 15. Okay. All right. So let's get started with our voting. On the screen, you can do it 2 ways. You can, with your phone, join via the QR code, or you can go to menti.com and type in the code 95383361. And while you guys are voting, I'm going to stop sharing my screen, and Lucy Melinda, who's part of our coalition, is going to help pull up the poll so you guys can see it and see the results. So Lucy, I'm going to stop sharing my screen so you can share your screen. Nine 95383361.
Pam, there's a great question in the chat. Be sure that is there anything we need to be mindful of related to eliminating our own bias in this very cool scenario?
Ooh, that's a great question.
Yeah.
I would assume, and you're gonna have some bias because like you're ranking these based on what's your experience or important to you, or you might be looking at them based on what you're hearing in your community. So that's what's great about multi-voting, is that even if we were using scores, they're still biased at some level, right? But with multi-voting, that's why you do the voting multiple times, again, so that it's not some pet project that rises to the top. It ends up being, at the end, an issue that we all care about, even if it didn't rise up to the very top priority in the voting. Great question.
Pam, I also think the intentionality and the criteria
Yes.
is the other way that you do that. If you're thinking about burden and the data, that's the other way that it happens, is really trying to remind yourself that it's not, yes, it is your opinion, but it's your opinion based on criteria.
Correct. Based on standards of judgment that we've created prior to this meeting. Katie, about what number are we looking for?
I'm sorry?
How many participants do we have? I'm wondering how many votes we're looking for here.
We have about 54.
Okay, great.
So we're at 32.
Yeah.
So it's a good amount.
And it looks like 42 people logged into the Mentimeter.
Yeah.
Okay, so we'll see how many more we get closer to that.
It's been at 34 for a minute though.
All right.
Oh, we went up to 35. We got one straggler in there. 36.
Okay. This 38, all right. So we definitely know, based on what we've got here, that we're going to be eliminating air pollution, traffic accidents, and asthma. And then we have 2 that were voted for 18, which is youth behaviors and suicide among youth. So those are the 5 that we're going to eliminate based on round 1 of voting. So air pollution, youth behaviors, traffic accidents, and asthma. So now that we have that, you might want to cross through them on your piece of paper so you know, because we're going to update our polls. But now Katie's going to send us into our breakout room so we can start talking about the issues that are left here. So put your acting. We're excited to see how talented all of you are with your acting skills.